So, this video is for you if you've been wondering about your ovulation. Do you even know the right time when you are ovulating? Most especially for couples who are trying to conceive. Do you even know what your fertility window is all about? So, today we'll be discussing about ovulation and fertility window and how to time your sexual intercourse during this period so that you can achieve pregnancy. Disclaimer though, calculating your ovulation is not enough for you to get pregnant. There are other elements that must align and factors to consider: the sperm health, your hormonal balance, the reproductive anatomy, and overall lifestyle. But this video is just focused on how to calculate your ovulation to achieve pregnancy. So, what is ovulation? Ovulation is simply when the egg is being released, matured egg is being released. And when it's released, the egg lifespan is usually between 12 to 24 hours. That is the period where sperm should meet the egg for fertilization and pregnancy to occur. So, you see, no pregnancy without ovulation. So you must have been hearing fertile window. What's fertile window? It's just simply the period where a woman has higher chances of getting pregnant. And like I said earlier on, no pregnancy without ovulation. Egg has to be released. So usually a woman is advised to have unprotected sex at least 5 days before the expected date of ovulation, on the day of ovulation, and in some cases 1 or 2 days after the expected day of ovulation, because at times the egg might be released later than expected. So sperm can stay in a woman's body for 5 days, 5 to 7, 3 to 5 days, some even 7 days, but averagely 5 days. And the egg is released only one between 12 to 24 hours is the lifespan of egg. So most times there's the probability of missing your ovulation because of daily activities, going out and coming in. Before your sexual intercourse, there is possibility of missing your ovulation period if you're just targeting your sexual intercourse just only on the day of ovulation. So you see why it's important you start at least 5 days before ovulation. When does ovulation occur? Most women think that day 14 is the day for ovulation. That's not true for everyone. Typically, your ovulation day is calculated 14 days to your next period, not 14 days from your last one. For example, a woman who has a 21-day cycle, you subtract 14 days to her next period. That means 21 minus 14 days. That means her ovulation day is on day 7. You see, such a woman shouldn't be expecting to have sex on day 14 like a day 28-day cycle woman. That way she would miss her ovulation period and thereby having difficulty in achieving pregnancy. Hence, the importance of knowing your menstrual cycle length. A woman who has 30 days cycle minus 14, that means our ovulation should be on the 16th day. Don't forget, we said sex should have started 5 days before ovulation and probably 1 or 2 days after ovulation, and definitely on the ovulation day itself. So you see why it's important. For women who have irregularity in the number of days they count, there should be a range. So that range would help you to know more likely when your ovulation will be. For instance, some do a range of 28 days to 30 days cycle. There will be a particular one that will be much more frequent, at least more stable for 3 to 6 months, that you can say, okay, this is it. So I think that is it. I hope we know now that not everyone have their ovulation day on day 14. Common mistakes women who are trying to conceive usually make is waiting for the day of ovulation. Like we have said in this video, that there's a fertile window period, and that's the period you want to start having sex at least 5 days before your ovulation, on your ovulation day, and shortly after your ovulation, maybe 1 or 2 days after. Another mistake women make is the pressure of trying to achieve pregnancy in that particular month. Healthy couple can take up to 12 months before they achieve conception. It's normal. We'll be worried if after 1 year of having uninterrupted, unprotected, regular sexual intercourse, then we want them to see the doctor. When do you have to see the doctor? A woman who is 35 years and below, haven't had sex for 12 months, you need to see the doctor. But a woman who is 35 years and above, 6 months is the range before you see the doctor. Also, if you're having irregular period, you don't even understand how your period's menstrual cycle runs, you need to see the doctor. Ovulation, when ovulation is absent consecutively, for women who are using the ovulation predicting the kits, you need to see the doctor also. And then when you are having heavy bleeding with severe pains, that could be a sign that there are fibroids there. That is also when you need to see the doctor. And as a couple, you need to understand that it's a male and female factor that plays in achieving pregnancy, or if there's infertility issues, you need to be evaluated. So now that we've talked about ovulation and you've known about the timing of ovulation for different women and based on their cycle, now it just might be that you have been missing your timing. That's why pregnancy is yet to be achieved. That is excluding every other factor that surrounds achieving pregnancy. Okay, so if you have any question, any comment, or any clarity you need, please drop the comment in the comment section. I'll be there to see and then answer your questions as much as possible. Please like, share, and subscribe. Thank you.